Schizophrenia is a condition which affects how a person thinks, perceives the world, and behaves. About 0.5 to 1% of adults experience this condition once in their lifetime. It occurs in children too, but it is rare in them. Early identification and continued treatment can improve the outcomes. However, late identification and discontinued treatment can influence the condition to have a bad outcome. Hi, I am Dr. Jagadisha Thirthalli. I am a professor and head of the Department of Psychiatry at NIMHANS, Bengaluru.
What are the symptoms of schizophrenia?
People with schizophrenia develop false beliefs that people are going to harm them, they are talking about them, or they are influencing their minds or bodies. These are called delusions. Some of them can hear voices which others cannot hear. Rarely they see things which others cannot. These are called hallucinations. Over time, they tend to ignore things that are important for them. For example, their social circles, their work, their cleanliness, etc. And this is called negative symptoms. Many of them experience difficulty in concentration, memorizing things, and doing mental tasks. These are called cognitive symptoms.
How is schizophrenia caused?
In schizophrenia, there are changes in certain chemicals like dopamine, glutamate, serotonin, etc. in certain parts of the brain. Why exactly these changes take place is mysterious. However, we know for sure that certain sets of genes, problem faced during pregnancy, childbirth, and growing years, use of certain substances, and the stress that a person faces during his growing years contribute to cause schizophrenia.
How can schizophrenia be diagnosed? What are the available treatment options?
Look, there are no lab tests for schizophrenia. It is diagnosed based on the information given by the person himself and the caregivers that bring that person to us. The first step in the treatment of schizophrenia is to listen to the person's experience and develop a good relationship with that person. Almost every person with schizophrenia requires medications called antipsychotics. Nearly all of them improve substantially with these medications. It is important to note that most of them will require to take these for many years.
How can caregivers and family members support someone with schizophrenia?
Understanding and support from family members is critical in the care of persons with schizophrenia. The first thing that the family members should do is to understand that the person is behaving, feeling, and experiencing the life differently because he is ill, and he is not doing so deliberately. It is also important for them to encourage the person to get into activities that the person would have been doing before he became ill. It is critical that they also ensure continuity of care and medications, which will go a long way in helping the person to recover from schizophrenia. Schizophrenia can be managed effectively. Many people do not realize that they have developed schizophrenia and they will need help. Hence, family members should identify changes in their behavior and bring them for treatment early. With their continued support in their recovery, many people can recover to a large extent. Replacing stigma with compassion and encouragement will help in ensuring good outcome.